You know that feeling? The one where the monitor starts alarming, the room fills up, and everyone's looking at you to run the code? That moment isn't the time to remember your algorithms. That's the time to execute them. So we built something. The ACLS Med Simulator is a full Megacode simulator that runs in your browser. Real waveforms, real defibrillator, real scenarios that change based on what you do. 50 plus cardiac rhythms animating across 5 channels. You can shock, you can pace, you can push meds from a full crash cart, and every decision you make matters. Give the wrong drug, and the patient deteriorates. Miss the shockable rhythm, and you lose them. 16 megacode scenarios covering cardiac arrest, tachycardia, bradycardia, BLS, PALS, and stroke, each one with a real patient case, branching logic, and a full debrief at the end. Instructors or educators, you are our perfect candidates. You can control the entire simulation in real time, change the rhythm, drop the pressure, spike the heart rate. We built this because we've been on the other side of that monitor. 18 years of critical care, and we know the difference between someone who studied the algorithm and someone who practiced it. Most training apps feel like studying for a test. This feels like being in the code. And that's the point. Because in a real cardiac arrest, your hands won't remember what your brain studied. They'll remember what your hands did. That's why ACLSMED exists. Free to try, aclsmed.com. Go practice today.
Shock delivered.